All right, so go ahead and introduce yourself for me.
My name's Andrew.
And how long have you been a patient of NUCCA?
I started NUCCA, I did about 4 months in Texas. I took a year off. The doctor did tell me to make sure you get with a NUCCA doctor when you get up there to Washington, and I didn't. And I let it go for about a year.
Wow.
And realized I had to get in. My hand was going numb, and I didn't want to get back to where I was, so
You had experienced some of these things before.
Yeah.
That initially brought you to NUCCA.
Yeah, I had a fall in 2010, and I broke L1, 2, and 3. Well, fractured, and that was 2010. I healed up. It just fused back together. No surgery needed.
Wow.
But because of the curvature and my body trying to adjust to balance out, all of a sudden I had a numb right hand and pain, cramping in the bicep, tricep, forearm.
Wow.
And found out I had discs bulging on the spinal cord. So went into the doctor and injections weren't working. Got to the point where he said we're going to need surgery, and I really didn't want to go in and snip around in my neck.
Yeah.
So a friend had turned me on to NUCCA. I'd never heard of it, and I gave it a try. And within the first couple visits, I could look around the room.
Wow.
It was so soft. I didn't really think anything was happening, and I was a little skeptical. But within about three adjustments, I started healing really fast.
Wow.
Yeah.
So then you came up to Washington, some time passed, you started
Time passed, a year went by, and all of a sudden my left hand goes numb. And it was numb for about 3 days, and I knew I better get back in. So in the beginning, I was off about 9 pounds from left to right.
Wow.
And, the leg length was off about ½ inch or so. And this time, I was off 16.5 pounds.
Whoa.
Yeah. So, considerable difference, especially for not being in the kind of pain that I was in before. But I knew where I was heading, so I knew I had to get back in and get the correction.
Wow.
Yeah.
So was it a different experience?
This time through, yes, a big difference. The way that Dr. Lipinski takes just the measurement of me laying down, before the doctor just said, lie down, and then he just started, performing the
Okay.
correction. Here he has the head adjustment. Actually, it cranks, it moves my head. He gets down. It's much more involved. The measurements of exactly what he needs to do, and the fact that he took the X-rays after the first correction, and he didn't stop at the first correction. He did another one, and then took the X-rays, and then another one and took X-rays. He wanted to make sure he was going in the right direction.
Wow.
And my doctor didn't do that down in Texas. So
Wow.
it's a higher degree of NUCCA for sure.
Yeah.
Yeah.
Now, what was your experience after your adjustment this time around?
I felt great right off the bat. I'm a project manager, and I have to do flooring. I was subbing out all of the trades for the job. They were going to bring me down to half pay, and then they offered, hey, do you want to do the flooring, and we'll keep you at full pay. And I agreed to it. I'm 41. I don't really do that kind of work anymore. It's been years.
Yeah, that's hard on your body.
Yeah, and you're just hunched over all day and on your knees, and it's hard work. The first unit that I did maybe a week ago, it took me about 7.5 hours, almost 8, a full day, and then I came in for the correction. Yesterday, I did a unit in 4.5 hours.
Whoa.
So it's just I'm able to continue and not have to take breaks and stretch and stand and get off my knees. I was on my knees all day, and I felt great.
Wow,
Yeah.
that's amazing.
Mm-hmm.
So that's huge. I
Yeah.
mean, that's quality of life for your work,
Yeah.
for at home.
Yeah.
That's crazy.
Can pick up my baby boy.
Oh man,
And,
that was difficult then before after
yeah.
a day's work.
Yeah, for
Yeah.
sure.
Yeah, that's
Yeah.
hard.
Yeah.
You can't pick up your kiddo?
Yeah, you want to come home and, give him a big hug, and he's at your legs hugging you, and, I got to get down and kind of give him a hug, and yesterday I just picked him right up.
Oh, that's awesome.
So, yeah,
That's
quality
awesome.
of life is much better.
That's huge. So if somebody around here was looking at, a potential back surgery or something that you were facing, what would you tell them about NUCCA?
I would definitely, try to steer them towards NUCCA just to try it. I know a lot of people are skeptical out there on chiropractic work in general, and this isn't your normal chiropractic work. It's dealing with the upper cervical and the atlas. What balances your head, and it's worth going in and having him adjust you before you have anybody go in there and snip around, just because these doctors actually specialize in, and they have a lot of patients who have had those surgeries, and why not try this before the surgery? Surgery should be the last option, and I've never heard of anyone doing NUCCA and it not working.
Yeah.
So
great.
Yeah.
Well, thank you so much for your story and for sharing with us, and
Yeah,
we're
you're
excited
welcome.
to see you continue to heal up.